So, today I want to talk about the coronavirus vaccine and distribution. The distribution of the vaccine has been a lot slower than what was anticipated. The Trump administration had been proposing that 20 million Americans would have the vaccine distributed to them and potentially within their arms by the 1st of January, so by the new year. And this was through the, whole idea of Operation Warp Speed. Now, this didn't happen. And logistically, that's kind of unsurprising, to be honest. So, I actually want to talk about some of the logistics that have been going on with the vaccine being distributed out and a lot of the details of why this has been such a difficult vaccine to get into people's arms, let alone getting them from one facility to another in a safe way. So, the first issue that occurs is that the vaccines need to be kept at really, really cold temperatures. So I'm going to be talking a little bit about the logistics of that. Secondly, I want to talk about some of the on the ground issues that once the vaccine has reached the location, what is occurring in certain locations and how is that manifesting in reality versus what was, expected. And the third thing I want to talk about is the 500 doses of vaccine that were wasted in Wisconsin and the kind of implication that provides for a distribution process of a vaccine to ensure the safety of everyone involved. With that said, let's jump right in. So, first and foremost, both the Pfizer and Moderna vaccines need to be kept at extremely cold temperatures. The Pfizer and Moderna vaccines rely on mRNA sequences, and this particular process requires that the vaccines be kept really, really cold to maintain its potency. The Pfizer vaccine needs to be maintaining a temperature of minus 70 degrees Celsius or, negative 158 degrees Fahrenheit, which requires a very special commercial freezer, which allows those types of temperatures to be maintained. And this particular vaccine, the Pfizer one, can only maintain a temperature of regular refrigerator temperature for 5 days. So when these particular vaccines are shipped and are being put into trucks, they have to be kept in a form of, thermal shipping, and they have to be kept under dry ice conditions. And so from what they're saying, the Pfizer vaccine can last up to 30 days after being put in these type of shipping containers. So you're dealing with the type of logistics of maintaining that temperature while having to send it off on a truck to have the truck maintain a certain temperature while it's traveling to get to a location, which then has to maintain the temperature again. Because if the temperature is broken at all, the vaccines become inert. There's a timer that ticks off the second they thaw out to a certain temperature. And so the Moderna vaccine actually requires to be kept at minus 20 degrees Celsius, which is minus 4 degrees Fahrenheit. And it will last for 30 days in standard refrigeration. So you've got this situation where the Moderna one is a little bit more potent and might be better for rural vaccines and rural distribution of the vaccine into rural communities because it doesn't require the cold refrigeration for as long, and you might be able to store it for 30 days in the span of time of trying to get it out to people. But in either case, if they thaw out, they need to be used pretty much immediately. You have a couple of hours to maybe a day or two to actually use it once it is fully thawed out. You can't refreeze it, it's set in stone. So with this particular part of the process, once you have it on the truck and once you have it into certain facilities, they have a limited time span to use it once it's thawed out. So you're dealing with the logistics of all of this shipping process, which is a lot more difficult than it sounds. Getting things onto a truck in a way that maintains temperature, that maintains certain other aspects, is a very difficult process. You have to be good about the whole thing. And you have to maintain constant check-ins of where the location of the truck is, make sure that it's being, well taken care of, that nothing's happening, that the cold ice doesn't melt, that you're not constantly having to re-up it without it being properly re-upped. There's a lot that can go wrong in this distribution model. And unfortunately, it's the best one we have for the vaccine that we have. So currently speaking, as of recording this video, there are 13 million dosages, more or less, that have been distributed. But only about 4.2 million have actually been received by patients. Now, this vaccine has different effectiveness rates based on how many dosages you get. Typically speaking, to see the kind of level that we'd like to see of like a 95% rate, you want to get 2 dosages. So right now we've got 4.2 million Americans having received their first dose, no totals really for a second dose, and only 13 million of these vaccines have been distributed out. This is nowhere near the 20 million marks that we were talking about for distribution, let alone, for getting them in people's arms, rather, let alone distribution. We're still at least 7 million off of that mark. And so I'm sure that the issue with keeping it cold and keep maintaining getting it from facilities that are producing it into the hands of state facilities and making sure that it's in proper cold storage has been an issue in and of its own right. So with that said, there have been certain logistical issues that have occurred on the ground in a lot of these cases. Specifically speaking, you have a situation where the same people who are being tasked with taking care of patients are the ones who have to distribute these vaccines. Because medical facilities like hospitals are the places that would have a type of cold storage unit that could actually maintain storing the vaccine in, itself. So you have people who are already overworked, overburdened, and struggling in the place of having to now watch over this whole process. And of course, we started this distribution during the holidays, when a lot of people weren't even in the office or available to start spreading the vaccine to people's arms. So that's been another challenge in this particular situation. So you have a situation where, health officials and hospital leaders throughout the country have, pointed to these differing factors on why this is not, properly equipped to handle this situation. And as Dr. Ashish Jha has said, we've taken the people with the least amount of resources and capacity and asked them to do the hardest part of the vaccination, which is getting it administered into people's arms. All of the logistics of getting it to facilities was handled by the federal government. But now you have local officials, health officials, and hospitals that are already overstretched maintaining and running this while they're running scheduling and staffing issues. So certain situations that have been occurring include, like it says here, the health departments have been overburdened. So you have a situation, for example, in Montgomery County, Maryland, where the local health department has had to recruit extra people to distribute the vaccine, and that the county health department has only been getting a few days' notice before they actually receive a vaccine shipment. So once that vaccine arrives on the ground, you have a situation where clinics have to start getting dosages out as soon as possible. So that means making phone calls, contacting people, reaching out to the people who are most vulnerable on your patient lists. That of course also means that you have a patient list and that you've had the opportunity to develop this in this short span of time, and maintaining that and figuring that out against patients who need it the most. And so you have a situation in Texas where a significant portion of the vaccine distributions might be sitting on hospital shelves and may not actually being given to vulnerable Texans, according to the governor. You have the situation with Mike DeWine in Ohio rather, who in a news conference said that roughly 60% of the nursing home staff members had actually declined the vaccine in an attempt to give it to more vulnerable groups like the elderly, but that the rollout to the elderly has not exactly happened. So again, this is running into issues of who do you give it to first? How do you give it to them? How do you get them into the facilities? And how do you maintain all that when you have staffing issues and an exhausted set of nurses, especially, that have just been dealing with this pandemic for months now? And it's falling on a lot of the same people who are exhausted, who are completely burned out from this situation. And this comes from the group of people who should be the easiest to get this out to. You have a situation where the people that have been prioritized are healthcare workers first and foremost, and people who are in nursing homes and the elderly who are the most vulnerable to the disease. And we're struggling because not all of them are willing to take the vaccine. We're struggling because of the logistics of having to make phone calls and call them into the office. And we're running on time limits that are being imposed by the temperature of the vaccine. And when it's thawed, it's thawed. And if somebody doesn't show up to the appointment, who do you rush in their place to get the vaccine in their arms? And so it's slow because you're trying to get it to the most vulnerable people, but at the same time, you don't want the vaccine to go to waste. And this is going to get even worse as we enter into new versions and new models that we have to put out there of who is of top priority for the vaccine. How do you decide who schedules the next set of appointments? Who will be the people that have to provide some sort of medical documentation that says that they're the next set eligible? And when there's no federal mandate on any of this, and there's no any sort of standard across the board that doctors can look at and be like, well, who do we prioritize? This is going to be on a case-by-case and state-by-state basis. And this does not provide for a very effective model. For a lot of the things that I believe in, I believe that we should be having a more hands-off approach. But on something like a vaccine distribution, you really need a very federal and uniform model to apply standards across the board, to be able to tell people who comes first, who comes second, and how to do this. And part of the other issue is that a lot of people are afraid of the vaccine for a number of reasons, including the fact that it's new. You also have anti-vaxxers out there who are spreading a lot of misinformation. And honestly speaking, we'd love to see a vaccine have the gold standard and 10-year clinical trials and all this, but we're not in that luxurious situation. We have to trust that Pfizer and Moderna have done the best they could, that the trials have proved to be as effective as they could be, and that we're going into this situation as best as possible. And there are not enough politicians, especially in more conservative Republican areas, taking the time out to say, no, you need to get this vaccine. It is effective and it is good. And talking to people about what exactly is going on here. Now, one other piece of good information in this whole distribution process is that if the virus mutates, it seems that it's very unlikely to affect how the vaccine works. And over time, if it mutates enough, we can very easily respond to it. The way that the vaccines are being handled is they're responding to the spike points on the coronavirus. The spike points being the point that latch onto your cells and start the replication process. So if one of the points that are being targeted, because I think there's approximately 6 different ways that they can approach it, if one of them mutates, the other 5 should still be, able to be stopped, and it should more or less neutralize the virus across the board. And again, if it mutates enough across the board, you can just change the RNA sequence and make it so that this is, still effectively inert. You can really slow the virus down. We don't know if it can still spread from person to person after that happens, but we know that we can make the virus slow. We can slow down the process of infection and spreading. We can neutralize it in certain people and populations. And the coronavirus does not mutate quite as quickly as something like the flu. So there are a lot of good signs across the board that once we do figure out how to get this distribution model in place, that it will work. But this often speaks to the issue that happens within the United States, where we're ready to be on the innovative cusp of technology. We're ready to reach this place where we're going to have the best vaccine in the world, where it's just going to reach everybody, but we don't actually talk about how to get it into people's arms. Healthcare is lacking while innovation is really out there. And we need to start working on systems to start fixing that gap of how we get the vaccine and other things that we need to distribute from person A to person B, because America in general has a huge distribution problem within terms of its resources. And before I close off, I just want to talk about what happened in Wisconsin with these 500 vaccine doses. So basically, in Wisconsin, you had a situation where 57 vaccine vials were left outside of a refrigerator, and it appeared to be an honest mistake. That somehow it just got left out, and, mistakes happen. You have tired doctors, you have tired pharmacists, this kind of thing can happen. But it turns out that on Wednesday, the health system had announced that the act was intentional. Aurora health leaders had said that the vials had been removed not once from the freezers, but twice. And that means that a lot of the vaccine dose shots that they were able to try to salvage out of that, those vials, the 57 vials, essentially became ineffective. And so people got injected with an ineffective vaccine. Does that mean that people are at risk? No. But what it means is that they are now not immune to the coronavirus in any capacity. And so they're probably going to need to have a replacement, and this proves to be a potentially dangerous situation. So I don't know why this person did it. The FBI isn't coming out and saying. Could it have been somebody with anti-vax beliefs? I don't know, but some people are speculating about that, and I don't know. Nobody does, because the FBI is keeping it very under lock. What I will say is that the biggest problem with this is that it also means that facilities are going to have to maintain, on top of the cold storage, on top of contacting people, proper security measures of maintaining and watching with cameras how their vaccines are removed from whatever storage unit that they're in. You have to maintain the fact that they're actually being held under these cold temperatures, that the freezer didn't decide to drop temperature over time. We have to be observing these things. And this is very difficult to maintain on a case-by-case basis to make sure that we're constantly spreading an effective vaccine, and that this is going to work across the board, and that nobody's being left out. Again, this whole distribution model is a difficult one. From the cold temperatures to the on-the-ground logistics issues of having to make phone calls, assign appointments, figure out who comes first. And then, of course, there's maintaining the cold storage and the temperature and the electricity and the power, and making sure everything is just maintained perfectly across the board. Vaccines are probably going to go to waste during this process. And having purposeful situations like this is not going to help the situation or confidence. And that's, of course, not factoring in the fact that a lot of Americans are very fearful of this. Some for very valid and good reasons, like people of color across the board having been experimented on historically when it comes to stuff like this. And really, really bad reasons, like just general anti-vax and anti-scientific perspectives and going against science as a whole, and claiming that Big Pharma doesn't have a good interest here. I mean, you can say what you want about Big Pharma across the board, but at the end of the day, these vaccines are tested and as proven as we can get, and they're the best options that we have. With that said, if you like this video, give it a thumbs up, hit the subscribe button and bell for notifications. You can follow me on Twitter and check out my Discord in the description down below. I am Anarchist Tara. I hope you enjoyed watching, and I hope that this sheds some light about the distribution issues that are going on with the coronavirus. Have a great day.